Today we are going to be talking about connecting patients to community resources, which is a part of our current MOC project, Improving the Quality of Care for Prevention and Treatment of Childhood Obesity. Again, my name is Sarah Na. Many of you know me as the Manager of Obesity Prevention Initiatives here at ICAP. This project is funded by a grant from the Otho S.A. Sprague Memorial Institute and the Illinois Department of Healthcare and Family Services. I have no relevant financial information to disclose at this time, and I do not intend to discuss any products or services. So today our learning objectives for this presentation are to deliver a basic overview to healthcare providers about how to best access available obesity-related community resources, including clinical weight management programs throughout the state of Illinois. Additionally, we hope to share some practices, approaches to improving the linkages between your practice, patients, and then local community programs. So first, we're going to talk about how to access community resources. So as many of you know, there are recommendations in place right now that ask that providers were based on a chronic care model, which is, as many of you may know, a more comprehensive model of care, which includes patient self-management, expanded practice, an expanded practice team, patient education, and so forth. And a piece of that requires that community resources be integrated along with healthcare. Additionally, the United States Preventive Services Task Force recommendation includes referring children ages 6 and older to weight management programs, asking that those programs include a targeted diet and physical activity component. And sort of where we are right now is that practices can prepare for incorporating do that. Right now, ICAP has sort of done a lot of that legwork for you. So on ICAP's website, illinoisaap.com, we have mapped community resources into the following categories. There are clinical weight management programs, community-based nonprofits, programs available for groups, programs that are school or site-based, food and nutrition resources, park district programs, community coalitions. So when you access our website, the map is divided up into little categories, as I mentioned before, and this is the key to recognizing what some of those icons are. So again, we have community coalitions and health departments. Physical activity programs is the little soccer player. If there are female-specific physical activity programs, it's designated by the little female icon. Nutrition and cooking is a knife and fork. Programs that incorporate both physical activity and nutrition are the blue dot, and then YMCAs are the yellow house. So just to give you a basic overview of some of the resources that are currently available on our website, this is an example of a clinical weight management program. It is down south in Carbondale, Illinois. It is the Shawnee Health Service Adolescent Health Center, where they offer nutrition counseling for children ages birth through 25. The counseling is also financial assistance is available for qualified patients. So this is the type of information that you can expect to find on the website when you look for available resources. So Cooking Matters is a nutrition-based cooking class and is an example of a food and nutrition program that is listed on our website. I don't have a picture of the map here because this program currently serves the Chicagoland area, so there's not one specific location for this program. This is a hands-on class that are taught by volunteer culinary and nutrition experts, and they actually will conduct these classes in a variety of community settings, including a physician's office. So all they would need is access to a sink with hot water. Obviously, if there are additional opportunities available like a kitchenette or so forth, they would use that, but they actually have the ability to bring in a stove top and all of the materials necessary for the program. Cooking Matters teaches participants how to select low-cost ingredients and use them to create healthy meals. And they do offer specialized curricula, including practical nutrition information, food budgeting and shopping tips, recipes, and free groceries to take home. It is currently designed as a 5-week, 2-hour lesson program, but they are in the process of potentially developing options that would include a one-time event. The ages for this are all ages. They have classes geared specifically towards adults, families with children ages 6 and up. They have kids-specific classes, which are for school ages 3rd through 5th grade. And then they have a teen program for grades 6 and up, and they are rolling out a new program that is geared specifically towards child care professionals. So next we have an example of a physical activity program. This is the Rockford Wildcats, which is the youth cross-country team. Obviously this is located in Rockford. This is designed to let kids have fun while learning about running, ages 5 through 18. It is free, and they do actually host meets throughout the year, not so much in the winter, but throughout the fall, spring, and summer. They do not have mandatory practices, but attendance twice a week is strongly encouraged, and they offer a variety of practices throughout the week to help accommodate as many schedules as possible. So lastly, we have an example of a community coalition, Gen H Kids Coalition, which is located in Springfield. So this is a nonprofit volunteer organization that is working to address child health issues, including nutrition, health education, and physical activity in and around the Springfield area. So what they do is they help to advocate for programs and also host programs themselves for parents, children, and educators, and some of those options or programs include Brain Breaks, Get Fit on Route 66, Mad Mud Dash, Destination Dinner Table, and all of that information is available through their website. So now that we've taken a look at some of what the specific resources are, the best way to access this information is to actually utilize ICAP's website. So we're going to take a couple of minutes to go through how to actually utilize the site to best search for your specific patient criteria or location. And again, all of this information is located on ICAP's website in a handy how-to format as well. So to customize your search based on location, the first thing you're going to do is open the map by using the web address below. So that's the easiest way to access it. It's a tiny URL web address. And if you don't remember that web address, you can access it through the obesity page on ICAP's website. So once you've opened up the map on your screen, what you will do is, just like any other Google Map function, you will type the address near where you want to search for programs into the bar at the top, and then click the blue button with the magnifying glass on it. So it can be as specific as you want. It can be an actual address, either a patient's address or the location of your practice. It can be as broad as a zip code or a street intersection, whatever makes the most sense for you or your patient. So once you've typed in your address, what will happen is the site will hover in on that location. So then what you will do is you will place your mouse in the bar. So once you've done that, obviously you're going to want to zoom into a space that is best for you. So you can either do that by using the scroll wheel on your mouse, if your mouse has that capability, or you can actually simply click on the plus or minus buttons that appear on the left side of the map, and that will enable you to zoom into a space that is more easy to search. And then what you can do is, based on the resources that appear in the area, you can click on the location marker to learn more about what that resource is. So for example, in this case, we've gone ahead and clicked on the little female icon, and what's popped up is the program Girls in the Game, which is a physical activity and nutrition program based in a school specifically for female students. all of the information that pulls up in the box will include an address, a phone number, contact name, and website if available. So once you've found a program that fits the needs of your patient or seems like it would be a good option for you to refer to folks in your to patients and their families, you have a couple of different options. You can either print the information as it exists, or you can actually go so far as to print directions specifically to that location, or you can even send the information via to a person's email address. So I know that was sort of quick, but that was a basic overview on how to actually use the map section of the site. To accompany the map, ICAP has actually pulled all of that information from the maps into a detailed spreadsheet. And that is available at the link at the top of your screen. Again, it's a tiny URL website, but instead of promoting health map, it's promoting health resources. And again, if you don't remember that link, that's okay. This is available on ICAP's website as well. So the following information is listed for each resource in the spreadsheet: the names, the focus areas, if there's a cost associated with it, age ranges, a description, locations, and so forth. So it is essentially the information that is located on the map. It's just displayed in a different way, and some of the information might be a little bit more comprehensive. So we've provided 2 avenues for you to access or learn more about community resources in your area. Hopefully will prove useful when trying to connect patients to resources, local resources. That being said, there are ways that you can help us to improve the site. So as you can remember from that screenshot of the state of Illinois, our hope would be that it would be completely covered in all of those icons because we would have mapped all of the available resources that exist across the state of Illinois, but we have not done that yet. So if, for example, you're looking for something and you know a resource exists but you don't see it on our site, you do have the option to create a quick online form to have the resource added to the map in the spreadsheet, and that is available on our website. It says, click here to add your resource. The other thing you can ask us to do is if you type in your zip code or an address near to where your practice is and you're realizing that there just is sort of a lack of available resources that are showing up on the site or spreadsheet, please do feel free to reach out to us and we are able to perform a more customized search in your specific area to provide you with additional resources that will then be added to the map and spreadsheet as well. So now that you've learned a little bit more about how to access some of these resources, the second piece is what do we do once we've determined that the resources exist? How do we actually then go about linking patients to the community resources? Prior to the current MOC project ICAP is involved with, ICAP participated or ran a research project linking practices to community resources. So in the previous project, ICAP provided over 50 community resources for the 3 participating practices. And the research and the information that we gathered from that project, first there were patient barriers that were reported with regards to participation in community programs. And some of those identified barriers included a readiness to change. So perhaps the patients weren't necessarily ready to start an exercise or a nutrition program. The location of the program was not conducive to the patients. The time the program was offered was a challenge to access. The type of program, and then cost. So these are all sort of the major barriers that I know you are all familiar with and that our previous project experienced as well. So additionally, what we learned is that the practices in the project appeared to prefer a few reliable resources with a single point of contact as opposed to a list of many resources in the area, perhaps without specific names of program directors or leaders in that area. And we also learned that practices discovered that assessing readiness to change before providing a referral was a key piece to improving that linkage between the patient and the community resource. Additionally, there were, so what the practices sort of did to address some of those barriers to patient participation, two of the practices developed an on-site nutrition program. So the nutrition program was done with the assistance of UIC nutrition students who at the time had been interning with ICAP. And the third practice actually went so far as to sponsor a physical activity program on site. That program was Girls on the Run. It was a physical activity program, as I mentioned, and was provided at no cost to the site based on their patient population, the fact that they had the practice offered a volunteer staff to help coordinate, and they had space available to meet along with close proximity to a park. So practices perceived that patients were more likely to participate in on-site programs, and they perceived it to provide an added benefit to the practice. So this is what how the previous practices addressed some of the barriers that they experienced in connecting to community programs. Additionally, all practices expressed the need for establishing a practice referral system. So what the practices sort of realized is that if they could sort of coordinate or find a way of easily coordinating care consistently with practice as a medical home, it helped to address the barriers to patient participation in the programs, in that they had the ability to perhaps provide a more customized approach or a customized referral to actual programs that best fit the patient's needs. So they could actually address location issues or cost issues, and they had the ability to continue to follow up with the patient to check to see whether or not the patient was satisfied with the program or had even been able to connect with the program. And lastly, there's an option for closing the loop with the provider. So enabling that last piece of feedback to say, either in the most likely in the medical records, to say that the patient had been successful in connecting to the community program, so it would continue to facilitate that conversation between the patient, the family, and the provider. So given the information that we learned from the previous project, there are a couple of suggestions that ICAP has for making those referral options. So the first is to identify several local programs using ICAP's resource map and have them already printed to hand to patients. So this is sort of a blanket approach, and I know from talking with a couple of practices who we have met with already during the course of this project, that handing out a packet of information is sort of the easiest and most population criteria or specific location. And like I said, it does require a little bit of time up front, in that you do have to do a little bit of digging to find the resources, but ultimately that's all the time that needs to be put in. And lastly, if you're having difficulty looking for resources, or you sort of want the immediate effects of having the packet in hand, you're more than welcome to reach out to ICAP and ask us to help you create them. The second option is to recruit a practice team member to act as that community care coordinator, which we talked about a little bit earlier. So in other practices, this could be identified as a nurse, a medical assistant, a social worker, etc. And they can be utilized to help provide those customized resources and work to address specific patient barriers. They can also assist with follow-up to ensure better compliance. The trick with this is that it does require a little bit more time and practice resources. So we're aware that not every practice has access to a social worker, for example, but this is certainly an option for those who are exploring ways to better streamline care coordination. The other option is to investigate how to host an obesity-related program on site. So obviously this has the added benefit of higher patient compliance with the program, given that it can be located in a place that they are already familiar with and visit perhaps on a regular basis. You do have the ability to potentially customize the nutrition and or physical activity specifically for patients. So you could gear it towards teens or younger children. You can offer it as a multi-class program or a one-time event. But again, this type of option requires available space and resources from the practice. So one of the larger barriers that we've heard from folks is that there are resource-poor communities throughout the state of Illinois. They exist in both urban and rural environments, and ICAP is working to try to address those issues on a larger scale, but there are a couple of options for you in a practice to address the issue if you do actually live in or practice in a resource-poor community. So the first option is to utilize ICAP's resource map to see if there are any coalitions or health departments in your area or county who are already addressing this issue. From the map earlier, we are putting up coalitions and health departments who have committed to address the issue of childhood obesity. And oftentimes it's a good place to start in terms of finding local groups or like-minded individuals who are addressing this issue, and it's in a way for you as a practice to continue to advocate for the creation of programs that would benefit your practice. The other option is to utilize ICAP's website and our staff to identify materials to post in the waiting room and patient rooms, or to utilize in terms of handing out the information to your patients. So a recent study showed that 34% of patients indicated that pamphlets in the waiting room help to improve health knowledge and self-management, and other materials that can be helpful for people to take home or to look at or to engage their providers with are My Plate, Fruits and Veggies, More Matters, the 5, 4, 3, 2, 1, Go materials from CLOC are all examples of materials that are available for free and can help engage people in the conversation. So one of those materials that's available, or if there aren't any resources available, for example, in a more rural environment, is to utilize the quote-unquote prescription pad to encourage healthier behavior. So below you'll see an actual example of a prescription for outdoor activity. And again, this information, these resources are available for a download on ICAP's website. But it's pretty basic, and it just sort of is a conversation or a way of holding the patients accountable to some sort of mutually agreed upon physical activity. So you could put the name, the date, what the schedule is like throughout the week, and then you can have either the parent or the child sign, and then a healthcare provider. And some of the options are, just go outside and play, visit a park, take a walk, ride bikes. Understandably, sometimes this isn't an option for families who live in neighborhoods that aren't considered safe to be outside at certain times, but certainly this is an option for maybe folks who live in the more rural areas or perhaps closer to forest preserves, so on and so forth. In addition to the prescription for outside activity, this is the AAP's prescription for healthy active living. So this is a little bit more broad. It doesn't specifically require a prescription for outdoor activity per se, but it does give a couple of tips for a healthy and active lifestyle. So 5 fruits and vegetables, limit screen time, physical activity, and sugar-sweetened beverages. So this is a little bit more engaged in that the patient is actually setting a goal and what they would like to work on first. And again, this is a way that when the patient comes in for a follow-up visit or when you see them next, you can say, based on our conversation and our goal setting from last time, how were you at eating, 5 fruits and vegetables a day, or, getting outside for 30 minutes? Do you think we could bump that up to an hour? So just as an example of some of the materials on ICAP's website, they can be found at the link at the top. I know that's a little bit long, but if you would like me to send it to you, I will go ahead and do that as well. But below are just a couple of examples of office and exam room posters and materials that ICAP has researched and placed on our website that are currently available for you to utilize in your practice. So the prescription pad for outdoor activity is listed there. We have it in both English and Spanish, as well as the Healthy Active Living prescription pad, and a couple of comprehensive toolkits, including one that focuses on WIC participants, and another one to address how to stretch food dollars by buying produce. So in conclusion, ICAP has a user-friendly web-based map and spreadsheet of current obesity-related resources that we hope will prove useful to you in your practice and that you will be able to utilize in order to better help you become familiar with and access local programs in your area that you can recommend to your patients. Additionally, ICAP is available to conduct these customized searches for your practice and can also help to identify appropriate patient education materials if you are finding one that you need specifically, perhaps addressing a particular issue, say sugar-sweetened beverages, or if you would like information that's available in another language, we do have the capabilities to do that research for you. And the last piece is working with your quality improvement team to create a practice-specific referral system may be helpful in disseminating this information in a way that is not only conducive to your practice, but is conducive to your patient population. So, be it simply handing out a packet of information anytime a patient comes in for a well child visit, or going so far as to investigate hosting, say, for example, the Cooking Matters program at your practice, either once in a while or regularly and routinely hosting that program at your practice are always that you can work to improve your linkage to community resources. Last but not least, for additional information about resources, please feel free to contact me. Hopefully all of you have my email and my telephone number, but if not, here it is. And again, either just for general information about community resources, or if you would like us to customize that search for you, I am the person to get in touch with. So, that being said, we have the opportunity to take some questions if people have thoughts or have information they'd like to know a little bit more about. So at that time, do we have any questions? You can go ahead and raise your hand and I can unmute you at that time. All right, so it looks like we don't have any questions at this time. Is there anybody who has a specific barrier that they're experiencing that that wasn't necessarily addressed or that they'd like more information about potentially working through? Okay. Dr. Swider, I see that you have your hand raised, so I've gone ahead and unmuted you. Do you have a question? Dr. Swider, are you there? So Dr. Swider, I can't hear you, but I'm not sure, perhaps your own computer is on mute. But what we can do, there's a button at the bottom that says questions. And you can go ahead and type your question into that box, and we can go ahead and answer your question there. Okay. So the question that Liz asked is, how often do you update the resources? So the resources were, every resource that is on the map, which is close to 200 resources, were all updated by last fall, so about a year ago. We sort of go through piece by piece. So I would say about a third of the resources that I've been through at this point in time are all still current. If you're worried about how current the resources are, that is when you can actually reach out to me and ask me to provide a customized search, and I will make sure that the resources that I disseminate to you are they're all valid and current resources. What we're hoping to do is share all of our resources with the state provider database, which is run by DCFS. And the nice thing about that is they're staffed by people who actually, their entire job is validating resources, and they do that every 6 months or so. So once that partnership is formalized, that would be an option, is to access the resources from them, as that's a guarantee that the resources are at least 6 months current. Great question. Any additional questions? Okay. Well, thank you everybody for joining today. I hope you all are enjoying the end of summer. And as always, if you have any questions or thoughts about the presentation, please let us know. This has been recorded, so it will be available on our website in case you want to share it with other members of your practice. So hope you guys have a great day, and we will talk with you soon.